Hi, I'm Cheryl Witt. I'm the ag nurse for the state of Kentucky through the University of Kentucky Extension Office. And I'm here with Raising Hope today, which is also part of my job duties, because we are a coalition that came together to support the health and safety of our farmers and farm families. We originally came together to address the rates of suicide and depression in our farmers, and we quickly realized that safety and physical health and mental health all go together. There's a relationship between the two. So we started with nursing students with health screenings at the Farm Machinery Show and have grown since then, because we recognize that if we can prevent a stroke or chronic illness or disease, then we can help that farmer stay in the field doing what they love for as long as they possibly can. We also recognize that if a farmer especially, but farmers define their good health by being able to do what they need to do on their farm. Even if they had no extremities, as long as they could get up, get their job done and get what they needed done on the farm. And if I asked them if they were in good health, they said, yeah, I'm doing pretty good. So we want to keep our farmers healthy. So we try to prevent that development of chronic disease and catch things early to minimize its progression if we possibly can. So the characteristics that make the farmer successful in his or her occupation of farming: self-reliant, highly independent, hard work ethic, can also be a barrier when it comes to seeking help for either mental health or physical health. So we've tried to address that by outreach, education, and different types of programs. For example, the preventative health care measures, we bring those services to them. We also provide education and conversations within these smaller groups of farmers to encourage them to talk about their emotions and what to do if they consider themselves in a mental health crisis. If a farmer is in crisis, on our website, raisinghopeky.com, we have a list of different resources. We encourage people to also know the resources in their communities, simply because most of us live in a rural area and those resources are quite limited. The number one thing that you can do is text or call 988, which is the national hotline number. And you may not be at a level of a true crisis, but you really just need somebody to talk to. You can call that number. I will also say that, especially in rural areas, we encourage the farmers again, to support each other and be that friend that listens to help that person get to the resources they need. Pastors or deacons in the church are also in rural areas a good source, a resource for someone to go to.
Now listen to me, Chris. This is my challenge coin. It says you are appreciated. It says text or call 988 if you ever have a bad day. I know we all have good days, bad days. Firefighter and rescuers, we see good things and bad things. I know what goes through. Been there 35 years. Chris, I want to give you my coin, but my coin comes with a minimum of a handshake and a challenge and a hug if you want it.
I'll take the hug.
Okay, shake my hand. Now listen, Chris, you take my coin, you give me your word that if you ever feel down that lonesome and blue, you'll call me, you'll call 988. And a man that don't keep his word ain't much a man. You understand what I'm saying?
Yes, sir.
You give me your word or give me my coin.
I give you my word.
Love you, brother. Right there is the power of a handshake. And I told you I'd do it, and you come, and I did it.
Yes, sir. Thank you.
Again, if someone is in crisis, I highly encourage you to text or call 988.